Joining us now, Dr. Rob Davidson, an emergency room physician in Michigan and executive director of the Committee to Protect Healthcare. Thanks so much for joining us, Doctor. We always enjoy talking to you. As of today, as you know, 50% of the U.S. is fully vaccinated against COVID. But on the flip side, you see events like that motorcycle rally in South Dakota, where there's been a lot of vaccine hesitancy, people just openly saying, no, they have been vaccinated, they still don't trust it, and so on. How frustrating is that to watch?
Well, it's extremely frustrating because these folks are getting all of their messaging from their political leaders. You know, the governor of South Dakota, Governor Nome, Governor Ducey in Arizona, Governor DeSantis in Florida in particular are, basically digging their heels in. We've seen other governors who have a conscience, the governor of Arkansas, the governor of Alabama, actually showing concern for the people in their states because they see them getting in the hospital and dying and changing their tune. But unfortunately, some of these folks are just so dug in on the politics that they think their constituents want. They're not willing to do what they need to do to save lives.
And tell us what it's like now in your emergency room these days. How do the unvaccinated people respond to the news that they have COVID?
Well, I tell you what, I can draw on a few examples. I had a person come in and I asked them if they wanted to get the vaccine because they were there for some symptoms. Their COVID test was negative. They said, oh, no, I'm afraid of the ingredients. I said, well, which ingredients? Maybe I can talk you through it. And they said, well, I don't really know what's in it. And another flatly refused getting a test, said that I was going to tell her she had COVID so my hospital could get $100,000 because that's why we're doing this, getting that directly from the president last year during his attempt at reelection. Right. And then telling us that they won't take the vaccine because they think that we're going to give them COVID with the vaccine, and just got angry with me and was yelling at me. And I had to, just exit the room and end the conversation because these are the kind of battles we're having when we're just trying to do what I've been doing for 20 years in my emergency department in my small community, just try to help people.
And some people might hear all this about breakthrough cases and think, why should I get the vaccine? Help set those folks straight. Please, what is your message to those folks who say that?
Yeah, I mean, your chance of getting hospitalized if you had the vaccine is, 1 in 1,000 compared to those who are not vaccinated. Your chance of actually getting very sick from COVID is so incredibly low when you're vaccinated. Yes, there can be breakthrough cases. Honestly, we all should have talked more about this at the beginning, saying, listen, and we did. We said 95% effective. That means 5%, you might show up with a positive test. You might get a little cold symptoms for a few days, but you're not going to end up dead. That is what we're trying to prevent. And that is what we're telling unvaccinated folks who are digging their heels in, who don't have regard for themselves or their community, who their leaders do not have the regard, who their media ecosystem that they're following on Fox News or on Facebook doesn't have a concern, but we're trying to have concern for them. They should get this vaccine for selfish reasons. Forget everyone else. It's going to save them from dying.
Right. And the CDC director tells CNN that they're working on a national strategy for booster shots. Tell us about these booster shots. When you talk to people these days about all of this, this subject always comes up, booster shots. Does that mean that the current vaccines need help to be more effective? That's also a common refrain that you hear.
Yeah, and I don't even know if the word booster is the right way to put it. I think it's just, might you need a third dose or a second dose if you had the J&J? Because, we know over time immunity does wane. Some vaccines, you get them when you're a kid and you're done for life. Others, we have tetanus boosters every 5 to 10 years in the emergency department ever since I've been doing this 20-some years ago. It's just how some vaccines work, and we don't know until they're out in the real world. And we can see if people are getting enough breakthrough cases or getting very sick with breakthrough cases. And it's going to be different for different people. Elderly, folks with immunocompromised status, they're probably going to need a third dose a little sooner than folks like me or like my teenage kids who are all fully vaccinated. So it's just waiting for the FDA to give us the green light. The drug companies are ready to go, but we can't let them dictate how this goes. They have to follow all the protocols, and the FDA will give us the green light.
Exactly. And let's look at this front page of yesterday's USA Today. This is a grim headline. Certainly caught my attention. I'm sure it caught yours. We are failing one another is the headline there on the front page of the USA Today. As an ER doctor on the front lines of this, do you believe that we are failing one another in this?
I do. I'm grateful that 50% of our population is vaccinated, but that means 50% is not, and a significant number of adults and older kids who could be vaccinated. And, I kind of think the time where we're trying to, appeal to their sense of community, their sense of other is probably past. And we just need to keep showing images and telling stories of people who regret not having been vaccinated and tell them we're here for you and you should do this to protect yourself, protect your family. Honestly, trying to get them to protect their neighbor or my family, it kind of, I think, is a moot point at this time. It's really appealing to their sense of selfishness so they don't die.
That is a powerful message, tough pill to swallow, but certainly the truth. All right, Dr. Rob Davidson, thanks so much. Great talking to you as always. We appreciate
Thanks,
that
Jim.
straight talk. And